Well, thank you for opening this video clip abstract that looks at the world perspectives on child abuse, a publication by the International Society for Prevention of Child Abuse and Neglect. ISPCAN was a survey of 64 countries and was released at the 15th International Congress in Brisbane, Australia in September 2004. So it overviews policies in those 64 countries. For example, it looks at the methods of surveillance for child abuse in terms of policy, and of the countries surveyed, 68% carried out population surveys, 67% carried out opinion surveys in relation to child abuse and neglect. In just over half, 57% of countries, there was an official count of child and abuse and neglect cases, and then under half, 44% of the countries, there was official death records for deaths related to child abuse and neglect. So there's some of the methods of surveillance in the variability by country. With regards to policy, the National Child Abuse Policy and their characteristics of these policies across countries, the researchers found that 81% of countries have an official policy on child maltreatment. 33% of those, or a third, are long-standing policies that predate 1980, and then there's a further 41% who established policies during the decade of the 1990s, so 3/4 prior to 2000. Most have criminal penalties in their policies. Many have both a mandatory and a voluntary reporting requirement of cases. In African and Asian countries, they were more likely to have voluntary reporting, and in those countries they were less likely to have an attorney required to be responsible for the interests of the child. So there's a summary of some of the differences in policies across the countries surveyed. Another subject they looked at was common treatment strategies. For example, what are the strategies with regard to child intervention services? Therapy programs for victims of sexual abuse, 84% had programs of that nature, although 35% of the countries only said that these services were adequate in at least 50% of their country. Therapy programs for victims of physical abuse, another 83% had such policies, and just under a third, 29%, said that such policies were adequate in terms of coverage across at least 50% of the country. Institutional care for abused children, 79%, substance abuse treatments, 78%, and group homes for abused children, another 60% of countries had such homes, such policies for children of that nature. So that's a range of the treatment strategies for child intervention services. Another subject that they looked at was common prevention strategies, and compare the difference between how effective policy makers in developing countries and developed countries. They found that developed countries, policymakers there saw a range of services as being more effective: home-based services, universal home visitation, increasing local services, universal health care, and improving the living conditions for families. All these were perceived as being more effective by developed country policymakers than in the developing countries. However, all countries considered training as important. 84% of developing countries used professional training, which compares with 97% with the developed countries. But the prevention strategy, training, was seen as an important component. And what are the barriers then to expanding these prevention efforts in their policy, prevention of child abuse? The most commonly cited barrier was limited resources, and decline in family support generally, And also the issue of strong sense of family privacy, restricting involvement and intervention in situations. Conclusions in the report, for example, this quotation from the report: expanded efforts are underway to address child maltreatment in all regions of the world. In many cases, such efforts are uneven in availability and quality, pointing to the variability. Another conclusion: a significant number of children remain at high risk for experiencing violence and other negative outcomes. So, in the conclusions, these situations are endorsed. We would encourage you to review the full document